colleagues online, 57 countries. I want just to say a warm welcome to everybody. We're delighted to see colleagues from Somalia, from South Sudan, from Myanmar, Pakistan, Syria, Panama, just to mention a few of the 57 countries that are with us online. In today's topic of this Transformative Agenda series, the title is, Where is the Money? Is your operation well funded? We're going to have and listen to donor reflections on the efficiency and on the results of the operations. I've actually asked our speakers, who I would introduce in a minute, to be as practical and as field-oriented in their reflections. The point of today's webinar is really to bring to all of you closer the donor reflections, but also to give you an opportunity to ask questions, to bring issues that are close to your heart, and to ask for clarification. We're all trying to increase efficiency, to reform, to improve, and this is really a great opportunity. And I have to say, in today's webinar is the first time in the Transformative Agenda series that we have the donors with us on the table. Before going into the actual substance of it, I want to repeat some ground rules. First of all, I'd like to ask everybody to keep your mic on mute at all times. If you unmute it, it really disrupts the overall flow. Secondly, I'd like to ask you all to make active use of the chat box. As you see on the right-hand side of your screen, there is a chat box. This is really an informal conversation. Please feel free to have almost a parallel conversation. Our speakers are all ready to engage with you and also answer in the chat box while the voice conversation is taking place. As with tradition with the webinars, this webinar is going to last for approximately about 90 minutes altogether, so about an hour and a half. During the first half part of this, during the first 45 minutes, I'll be asking a question or two to each of the 4 panelists with us this morning. And I'd like to encourage you from the get-go right away to start sending questions to us. As you can see, there is a question box, a Q&A box that you can click on the top right-hand screen, and then your box will open in front of you. I'll just I'm sorry, we've had a technical problem. Can you all hear me? Right. So this is the panel synthesis continuing just with the introduction. I hope that the technical problem doesn't repeat itself. So I was saying I would like to encourage you all to use the question and answer box. It's really important, and you can start immediately sending us questions. At about 15 minutes past the hour, I'm going to start taking your questions to the panelists. So for the second part of the discussion, we'll take the panelists and hear their views. In today's discussion, basically, we're trying to, first of all, hear our donors' point of view in terms of the reform, in terms of the efficiency, in terms of the results. And we've asked them to be as practical in terms of the things, the issues that they would like to see in proposals, they would like to see happening in the field, to make it as credible, to make it as efficient on the ground. I also want to encourage you to send your questions in terms of the issues that you would like them to hear of and see what and if needs to be done differently. I'd like now to move with introducing our distinguished panelists, and I'd like to start first with Sofia Calltorp, who's the Deputy Director and the head of the Humanitarian section at the Ministry of Foreign Affairs in Stockholm in Sweden. Sofia, warm welcome. I'd like to introduce Jeremy Konyndyk, who's the Director of USAID's office based in Washington, D.C., at the Office of Foreign Disaster Assistance, OFDA. Jeremy, fantastic to have you here with us. I'd like to introduce Klaus Sorensen, who's the Director General at the Humanitarian Aid and Civil Protection, based in Brussels with the European Union. So Klaus, great to have you here. And the fourth speaker is Manuel Bessler, who is Ambassador and Delegate for the Humanitarian Aid. He's the head of the Swiss Agency for Development and Cooperation with the Swiss government. Manuel, welcome. Great to have all four of you with us here in Geneva in this discussion. I'd like actually to go first, my first question to Jeremy, and really ask you, Jeremy, the key question we got from the field we're preparing for this is how vital the funding is, and really looking at the global picture. This morning I was looking at the financial tracking system, and for 2015, out of 18.8 billion requested, as of this morning we have received 26%. Of course, that puts a huge pressure. The needs are much faster. The world where we're living in, on the one hand, it's much wealthier than ever before. At the same time, we're at a record high needs. Also, I have to say, it's a record high funding. It's the second highest funding at this point we have received so far. This really puts the question on the efficiency, on what would you like to see, what is really the solution in order to move and have a better balance between the huge needs and the resources that are available. So what would you say are your key messages to the field, given this really impossible task that we have in hand? Jeremy, over to you.
Thank you, Panos, and thank you to everyone who is joining on this webinar. It's really excellent to see such a high level of interest from around the world in something as important as the reforms within the UN system and how we can all work together, well, not just the UN system and the humanitarian system, how we can all work together more effectively. So I would make three points on how we can make more efficient use of funding. I think the first is we really need the humanitarian system to be a system. And right now, when you look at the humanitarian architecture, we have this kind of patchwork of different types of agencies and different types of actors, and sometimes they work together well, and sometimes they don't. But there's not a very coherent structure around all of it. And 2 weeks ago in New York, the U.S., along with the World Humanitarian Summit Secretariat, the League of Arab States, and the OIC, hosted an event looking at the run-up to the World Humanitarian Summit and how we prepare for that. And one of the top recommendation coming out of that, interestingly, was that we need to collectively review and possibly reform some of the mandates and roles. Now, that's a huge lift. I don't know if we need to go that far. It's an interesting idea, but what it definitely underscores is that we have a system right now that was not designed to do what we are asking it to do. And part of the challenge with the funding situation is we don't have a system that is set up to be efficient and effective and is designed in a coherent way. So building more coherence into the system, I think, would be the first. And you can see that through the huge variance at field level in how effectively the system engages. So I think in South Sudan, we've seen a very effective engagement across the system, a very effective HCT, and a lot of good cooperation across agencies. We haven't seen that on the Syria response up until very, very recently, for example. And so some of the turf battles and the just coordination challenges and information challenges in Syria have been really problematic and a real blow to the overall efficiency. Second point I would make, we need to see a much stronger analysis and articulation of needs, coverage, and gaps across the whole system. So from a donor point of view, when we have to make decisions on, where do we put the next $1 million of our funding, we really want to be able to see what's already being done and get a good picture of that, and that remains virtually impossible, at least in a coherent way. We can see what we're doing with our funding, and amongst the donors, we're trying to talk more frequently about who is putting funding where. We can get pieces of it from OCHA, we can get pieces of it from individual agencies, but we really don't see anywhere that we get a coherent, definitive articulation of the needs, what is being done against those needs, and what gaps exist. And that really, at this point in the evolution of our system, is inexcusable. And that's something that I think, again, goes back to the structure questions. We see a lot of differences between different agencies' willingness to share information and to feed into common information platforms. So that's an area that we need to see a lot more. And when we see that, we will respond, and we will we will put our money where we can see a coherent, articulated case that a gap exists. The third, and very tied to these first two, is we need to see much more prioritization within how appeals are articulated. So I think that in Iraq, the HC Lease Grant has done a really excellent job of doing the tough, hard, unpopular work of prioritizing the greatest needs. And it's very difficult for us as a donor to use the appeals as a to use the appeals to inform our funding decisions when everything in the appeal is conveyed as having equal priority. And yet we all know that the appeal won't be fully funded. It will probably struggle in any given case to be 50% funded. So it's very, very important, though it's very, very difficult, for the system to prioritize what are the greatest needs in a setting, because if the system doesn't do that, the donors will do that. So it's a choice. Do you, as the humanitarian actors on the ground, want to be the ones driving that prioritization, or do you want donors and capitals driving that prioritization? Thank you.
Loud and clear. You're loud and clear. Working as one system. Really, this cohesion of being together. Stronger analysis, common cohesion on the needs assessment coming together, the prioritization, and bottom line, your message is you'd rather do it in the field, otherwise you will do it in the capital. So that's really a loud and clear message. I'd like actually to ask you a question on the other way around, if I may. A lot of pressure has been put on the humanitarians to reform, and I think there is a tremendous effort to try and be better, be more efficient on leadership, on coordination, on delivery. You, as in your capacity, the United States and Canada, you're co-chairs of the Good Humanitarian Donorship Group, where basically you're also looking at efficiency and how the donor group itself can really, in a way, reform and improve. Many colleagues, when we go in the field, talk about, the heavy reporting, the lines, all the various requirements. So can you give us in a nutshell, what are the results, if you want, of the Good Humanitarian Donorship Initiative? What is the donor's reflection, own self-reflection, in terms of what can be done differently to make it lighter, to make it easier, to make it better coordinated within the donor group itself? Jeremy, over to you.
Thanks again, Panos, and that's a great question, and we're very excited to have the privilege of chairing the GHD along with Canada, especially at such an important time when there is so much reform going on within the system. And looking ahead to World Humanitarian Summit, there's a very vigorous dialogue around the world right now on what best practices look like across the humanitarian system. And look, donors are not somehow exempt from the expectation that we need to do better. And the GHD was set up in recognition that donor practices had some real flaws. And so, we are about 1 year now into our chairmanship of the GHD along with Canada. We have a very aggressive work plan. I don't have some specific outcomes to share with you yet. I would say we're mid-process. So we are looking very hard at reporting and accountability requirements because there is some area there to better define what best practices look like. We're also looking at best practices around funding modalities. We had the GHD high-level meeting in New York a couple of weeks ago, and one area that I think there's a lot of consensus around is multi-year funding, and the need in protracted crises to look and plan on multi-year timelines and not just give out money in 12-month or 6-month or 3-month chunks, but rather to plan this and to fund these protracted responses in a more multi-year way. I think there's a lot of growing consensus around that in the community. Certainly on the U.S. side, that's a direction we've moved in the last couple of years. We're also looking very hard at risk management and risk sharing. And I'd be interested in hearing from the folks who are participating in this call, what is it that you need from us on that? I think we've heard repeatedly from the UN and from the NGOs they want to see more of a risk sharing between donors and implementing partners. We don't have I don't think we have a clear sense of what are the gaps that the partners see in that system now. I think coming out of Somalia a few years ago, there have been some real progress made. That clearly there were challenges in Somalia. But if you look, for example, at the Syria response or a place like South Sudan where there are also sanctions in place, I don't think that the sort of the sanctions and the legal risk have been getting in the way or arguably getting in the way that maybe they did in the past. We're also taking a look and investing in partners' security risk and their posture on that, and we've provided support through a number of agencies to better define some best practices on security risk management, and to ensure that on the donor side we're willing to invest in that, because that does cost money. And so those are a few of the things that we're looking at through GHD. I would make one more general observation, and tying back to the comments I made earlier. I think the bottom line is, as donors, we do need accountability, and so it's not a discussion of I think that this kind of framing it as we need lighter accountability or is accountability too heavy is not quite the right framing. There are different ways you could approach that. But what we need, where some of this comes from on the donor side is when we have a hard time getting the system to produce coherent articulation of needs and coherent articulation of priorities, then that throws the ball back in our court as donors on trying to find our own ways to get that. So if the system produces that more organically, the donors don't need to be as aggressive in demanding it through our own systems.
Thanks, Jeremy. I would say we stay tuned until also the good results and the work come to fruition, and we'll be interested really to hear the results of the work in terms of trying really to look at the various elements you talked in terms of reporting, accountability, the multi-year funding, and the various proposals. And I want to encourage colleagues as we go through, some of you have already sent us questions. Please keep on sending feedback as we go through. And I also want to encourage you to use actively the chat box. I'd like to move actually from Washington to Stockholm, from Jeremy to Sofia, who's actually with us here in Geneva. Sofia, I'd like to ask you, over the last few years, really a lot of effort has been in terms of improving the leadership, the coordination, the delivery, the efficiency, the results. When you look at the proposal, when really the field comes up with the request, what do you actually try to see in the most? And I would say, what would you like to see more happen, either the field or when it comes really to your capital in terms of the reform, and most importantly, in terms of the specific operation? What is your message to the colleagues in the field who are listening us? Sofia, over to you.
Thank you, Panos, and thanks to everyone staying tuned from the field. This is really a good opportunity for all of us to interact with those of you out there who are actually really working on the humanitarian response in practice. So really happy to be here. And let me first say, Panos, in relation to your question, if you look at humanitarian coordination today and you compare it to what we had, for example, in Haiti or in Pakistan prior to the launch of the Transformative Agenda, I really would like to stress that we have come a long way. We see stronger leaders, better coordination, and clear lines of accountability. And there's been a lot of efforts being put into having the Transformative Agenda work, and we do appreciate that. Of course, there's still a lot of work to be done before what I would say the cultural shift that needs to be taken place within the various individual agencies, but in particular at field level, really bringing the country team together. There's still work to be done, but we're definitely on the right track. And in relation to your question on what we have seen, I would like to highlight the development of the humanitarian program cycle and the sort of new new versions of the humanitarian needs overviews and the SRPs that we now see as really a tremendous improvement in joint preparedness, needs assessments, and planning. And I do know that at country level this might have been cumbersome, but from our level at headquarters as donors, this new appeal process and the bringing together of various agencies at country level, then being translated in a joint strategic response plan is definitely a milestone, I would say, in our joint efforts. So what then remains to be done, and how do we move forward from here? Would very much like to echo what Jeremy said on the need to be a system. We need this system to be more coherent, more strategic, coming together truly as one system, because that's the only way that we as donors can really look at the various needs and see where our money is best spent. We need to have a totality of the needs and of the sort of various priorities being done at country level in order to spend to place our money where they are best used. So I know that OCHA is now working on streamlining the processes for the humanitarian needs overviews and of the strategic response plan. So hopefully this process will next year be even smoother, more collaborative, and even as a result being much more strategic. We also need to better integrate accountability to affected populations in the programming, and we see some of this coming out. Sahel is a good example, but we do need together to find ways to really be much more tuned into the affected communities and see what works and what does not work, and also being able to redirect our programming and our funding according to the various sort of results of those accounts with the affected populations. Lastly, just to also follow up what Jeremy said on the GHD and what we as donors can do, I think we can be better in creating stronger incentives for coordination and collaborations among humanitarian actors. We can try to see how can we strengthen the pooled funds in the countries where we have such funds, and how can we as donors really sort of through our funding, encourage the humanitarian country teams at country level to work better together. That's something that, as Jeremy said, we discuss a lot among donors in the GHD group, and look forward to continue that conversation. Thank you.
Sofia, great, thanks. I'd like to be a little bit provocative and come back to you really with a follow-up question. We've just come back from the field. I've been in Iraq, I've been in Syria, and one of the most challenging questions that people put to us is really on the funding side. Is the system broke? This is what I've been asked repeatedly. There is a feeling of overwhelming that on the one hand, you really see a high number of people in need in displaced situations between Syria, Iraq, Yemen, Nepal, protracted crisis. For this year, we're asking for close to $20 billion in terms of help to help 18 million people around the world. Yet today we stand at 26% funding. Clearly, despite the fact that the funding is increasing every year, the speed with which the needs is deteriorating in a world with the crisis that we see, it's much greater than the ability to cover the needs. So how would you suggest, how can we really move forward in bridging this gap? And really to be able, and how can we really make kind of a better use of the resources? The limited resources are there. Today, we're clearly helping the poorest of the poorest of the poor. So how can we move forward in such an extraordinary situation? Sofia, over to you.
Thank you, Panos. Obviously, the gap between humanitarian needs and resources is one of the greatest challenges that we collectively face as donors and as actors in the field. And we try to do our part to come up with more funding. But as you say, Panos, obviously the needs are increasing so exponentially. So we will never be able to feed the system with as much money as is needed. So obviously we need then to find ways to spend our money in the most efficient way. Sweden is one of the countries that truly believes that there is a great merit to unearmarked core funding for effective humanitarian action. We do believe that we should place the responsibility where it belongs, that is with the actors implementing the programs, and we are one of the largest supporters of unearmarked core funding to the humanitarian system, in order to give the leeway to the agencies to make the hard decisions that they need to make at country level and at regional level and ultimately at global level on which needs that needs to be prioritized, etc. Unfortunately, the proportion of core funding to the UN agencies has decreased over the years, and we are trying to convince our fellow donor colleagues to see how we together can contribute with unearmarked funding to the agencies, but also, as I mentioned before, we do believe that the pooled funds are a key tool in this regard, because that is a way for the country teams to set their priorities and also receive the funding according to the priorities that they have set and not according to the priorities of us as donors. So unearmarked funding, pooled funds, but also, again, let me stress the need for the increased need for strategic needs-based prioritization, both in terms of what goes into the appeals, but also prioritization within the appeals. And here, I would very much look into feedback from the field on how we can support that type of sort of real strategic prioritization. And also make sure that those country teams that do work in this matter do not sort of get punished for making tough decisions, but that we as donors can reward the country teams and the humanitarian coordinators that are making tough prioritization decisions and make sure that those appeals are well funded. Thank you.
Thanks, Sofia. I've really heard you talking about coherence, about quality, really, of the comments coming and the reports coming from the field. Your message on accountability to affected people to the field and really involving them in the quality is really crucial. The use of pooled funds, the unearmarked funds, core funds, these are all really crucial messages for the colleagues to the field. I'd like now to move from Stockholm to Brussels. Klaus, coming over to you, and would like to hear it from the echoes from the European Union's perspective. One of the key issues in the efficiency of the response is clearly the speed. It's our ability to be able to be at the right place, in the right time, with the right response, to be able to help the poorest of the poor, the most needy, in an emergency situation where often political security is as impossible as it can be. This also requires a fast, a quick decision in terms of funding. The money has to be there to enable everybody to move in the best possible way. So, Klaus, in your view, how well have the stakeholders in the humanitarian response, the United Nations or the NGOs or the national actors, but also the donors, how well have they done in moving fast to deliver fast in the right place? Klaus, over to you.
Yes, thank you very much, panelists, and good morning to all of you out there. I'm completely new to this webinar technology, so maybe I'm pushing the wrong buttons, but it's great fun, I have to say. You cannot be fast if you have not prepared. So it all starts with the beginning of the project cycle. I think, first of all, you need the appropriate financial tools, but you also need very efficient alert systems. And alert systems actually require that you have worked on those systems way ahead. The analysis we get from HughesNet on the food security, the typhoon alert system, the tsunami alert system, the seismological collaboration we have with volcanologues and the specialists on earthquakes around the world, all of that has to be dealt with up front. We also have to as much as possible, come to good risk assessments and vulnerability analysis in all vulnerable and fragile countries around the world, because that would actually allow us to know where the preparedness has to be built and where the next caseload may come hitting us. So let's start with the beginning. When this is said, once a catastrophe has hit or an emergency is coming forward, we need very fast needs assessments. The MIRA is one instrument, but obviously after that we are looking to the international system to come up with well-coordinated, honest needs assessments. And I'm talking about real needs. I'm not talking about old pipelines that are just being revitalized, a kind of wish list. It doesn't interest me, but I want a full picture of the needs also in the least accessible areas so that we can actually judge when we then push the button for the financing, what is it that has to go first and what is it that we are missing? And not only we push the button to please this and that NGO or this and that agency. And there, frankly speaking, we have still a lot of work to do. We get sometimes wish lists. We get sometimes old projects that were not financed last time around, and we have to dig into that. And sometimes I feel, frankly speaking, rather handicapped or half blind because I'm not informed about needs in areas, for example, that are very difficult to access. So I cannot make the judgment on as to where I want to put my financing. This being said, we have, I think, the financial tools in place. I'm able to disperse within 12 hours or 24 hours up to 1 million, 2 million. It will take 72 hours if I have to go higher, 5 million. I need to involve the European Parliament if suddenly I want to dig in to the big reserved pots of money. If I have to mobilize another 50 million that was not pre-planned, then I need a parliamentary procedure. But I would say the moment the financial machinery kicks in, and as long as there's still money in the system, then the speed, in my view, is not a problem. And as you know, we have framework partnership agreements with a lot of our partners in the UN system, but also the INGOs and the NGOs. And all of those that have been vetted and are in that system can actually access the funds immediately. So that's on the financial side. When we speak about surge, which is the other part of the equation, if we have an L3, and even without an L3, I mean, you don't need that. But if you see something big coming, does it work? Something is happening? Something is happening. The question is what? Okay, right. Sorry for that, guys and girls. Just to say that on this search, we are able to deploy our humanitarian aid workers within 12 hours, 24 hours. As some of you may know, I'm also in charge of the coordination of the European Union civil protection capacity, which means that I can, as was the example in the Typhoon Haiyan, get people out there within 24 hours. It just depends on the air flights and the transport capacities. So there is a possibility to scale up, both in finance and in deployment of personnel. Let me leave it at that for the time being, panelists. I know you probably have your very clever questions coming in.
Klaus, it's encouraging to hear that funding could be mobilized in 12 hours. And obviously the whole risk assessment, again, your message on the quality of the information coming and the playing fair with all actors, the NGOs, the UN, in terms of what comes forward is crucial. I'd like to come back to a follow-up question, Klaus, and really as humanitarians in these horrible conflicts and situations, we often eyewitness or hear or see victims of violence, victims of gender-based violence. Unfortunately, this is repeated in conflict after conflict, situation after situation. In your view, how do you see the response in terms of the humanitarian actors, including women and girls, boys and men, as an element in the response? Have we really moved in the last few years? Is it integrated enough? How important is it when you look at it from an ECOS point of view when you receive a proposal? Over to you.
Well, I think the awareness has definitely increased of the necessity to target more narrowly the needs of most vulnerable groups, notably women and children, but also boys and sometimes even men, and to make sure that you think through the social dynamics in a given area. Are the men grabbing the food that was intended for the children? Do the girls have the same access in a given geographical area to health and food because they are subject to violence, and compensatory measures have to be taken? So there is an increased awareness, but obviously not enough is done. It's clear that sometimes our good partners and ourselves, we find it easier just to finance some food or just to install a clinic, and it looks nice on pictures, but we have actually not really thought through the dynamics behind all of that. As a donor, we have now, it has taken some time, we have put in a gender age marker in our projects, which means that the partners can go through a checklist. It's not a firm obligation to access funds, but if they want to use that marker, it actually signals to us that this project has some interesting features and maybe we should rather go for that than other projects. So the awareness and the targeting of these issues has actually improved. It's linked to the wider issue of protection and respect for international humanitarian law. And also there, I think we all, partners, agencies, donors, agree that this issue of protection has to climb up on the political agenda. I expect that the World Humanitarian Summit will put this smack at the center of the Istanbul commitments so that we will have a sharing of values that we can really not treat the most vulnerable parts of our population the way certain governments or armed groups or nasty people are treating them. So I take comfort from the fact that this political momentum will build in the next 12 months. Over to you, Panos.
Klaus, thanks a lot. I'd like actually now to move from Brussels to Geneva back to Switzerland, and I'll move to Manuel. Manuel, in our humanitarian work, we really look at the principles that really Switzerland is the birthplace. Geneva is really where all the values and principles came in place, looking at humanity, neutrality, impartiality, independence. We're also looking at conflicts in Syria, in Iraq, in many other parts of the world, where the political, humanitarian, security, foreign policy line becomes much more blur. Sometimes it gets all mixed up. In your view, how important, and for colleagues listening in the field, how important is this maintaining the principle approach and its relevance to contributing to an efficient humanitarian response? Manuel, over to you.
Thank you, Panos. Thank you for the question, and hello to everybody, the 100 and something out there. Great to be part of this event, and really a lot of fun also to follow you on chat and Q&A. Look, Panos, principled approach does not necessarily mean an efficient approach. That's why we say always we need a principled approach and efficient humanitarian response. You can be very principled, but perhaps you do not meet the efficiency. You can be very efficient, but not principled. For us humanitarians, it's indeed very important to have both. The principles, the humanitarian principles of humanity, impartiality, neutrality, independence are the the cornerstone, the founding principles of humanitarian aid. We have them because as a tool, as a way to get the assistance, the protections to those who need it. Whoever it is, on whichever side this person, this group is, it's important indeed to direct the assistance, the protection to those in need, and not based on any other consideration, policy, economic, or even military consideration. That's why the principles or the humanitarian principles are so important and really the cornerstone of humanitarian response. But of course, not only from a donor side, but also looking at the costs. It has to be efficient. You have to meet as many needs as possible. You have to reach as many people in need as possible. That's why we really look to have both of these aspects in humanitarian response. Not always easy, and there are sometimes also certain tension between principles or between principle approach and efficiency. But that's in the end a bit the art, if you want, in quotation marks, obviously, of the right, appropriate, and the good humanitarian response. Over to you.
Thanks, Manuel. I'd like to move actually to another topic that also Sofia hinted earlier on, which is really the engagement with the affected people, making sure we have this relation of respect, of dignity, giving account, taking account, making sure that the affected people are in the center of the response. What I would like to ask you from a donor perspective, first of all, what donors can do in order to further support this initiative, and how important is it when you receive a proposal or when you look at operations to make sure that humanitarians have indeed taken into account the beneficiaries, the affected people's point of view? Manuel, over to you.
Thanks, Panos. Look, as I mentioned before, the response has to be based on needs. So you have to know these needs. And how do you know it? You have to ask the people in need. You have to be out there. Donors have to be out there. You cannot only do humanitarian assistance from capitals by signing checks. You have to be out there, you have to have the pulse, you have to feel the pulse out there, and you have to make sure your humanitarians, be it you yourself, your governmental agency, or the agency you work with, the partner agency, be that Red Cross, Red Crescent, UN, NGOs, are out there and feel the pulse. And in this sense, as a donor, you can impose this on your partners. That means you provide the money, you allocate the money only if indeed this closeness, this proximity to the people in need is established, and you know, you are convinced, you hear, you read from your partners that they do this needs-based approach, that they have this close connection with the people in need, and you can make this as a condition, as you want also to have that the projects that you support financially are gender-based, that they are efficient. You want also that they are based on truly neutral, independent assessments, and this you have to establish, of course, with the proximity to the beneficiaries, to understand, to know what they need, what they want, and what they need. This is important from the very, very start of the design of a humanitarian action, and that's why you have to be out there. Back to you, Hannes.
Thanks, Manuel. I'm actually going to now take questions coming live from the colleagues, and I also want to encourage, I see over 120 participants to keep on sending questions as we go. And Jeremy, I'd like to come to you, and we have received a question from a colleague in the field who is asking about the question of protection, the centrality of protection. Really making sure that this human rights mindset thinking approach in our humanitarian response does take place. how important is this from a donor perspective when you look at the proposal, and what message would you like to give back on the centrality of protection to colleagues listening in the field? Jeremy, over to you.
Thanks, Panos. That's a really important question. So a few years ago, OFDA started doing a protection technical review of every single proposal that we receive. Protection is the only sector that reviews every single proposal. No one else on our technical team sees every single proposal. And we think that's important because, traditionally the humanitarian field, I think, has struggled to really mainstream protection through everything we do, but also because we see real challenges and real risks if we do not take a protection lens on every activity. So a good example of that, a very recent example of that, in South Sudan, we've been hearing feedback that there are populations who have fled some of the fighting in Southern Unity and have fled into the swamps, and have actually said they may not want to receive aid because they're fearful that an aid delivery would give away their location and put them at greater risk. And being aware of that dynamic is really crucial to making sure that we can assist them in a way that doesn't harm them or expose them to danger. But you need that protection lens, and you need those feedback mechanisms around protection concerns in order to avoid a really problematic outcome. And so having a protection review of every activity we do, we see as really, really crucial. At the same time, there are definitely settings where standalone protection is very important. And I think what has been a challenge, and was a challenge, for example, on Typhoon Haiyan, is getting good information and good feedback from the ground on protection needs right from the beginning. In the early days of our Typhoon Haiyan response, we sent out a protection advisor, and we asked the protection cluster, what is the greatest need on the protection front right now? Should we be doing standalone protection programming? And it was very interesting. The feedback we got from the protection cluster was, no, actually, that wasn't an appropriate time to do standalone protection programming. The biggest needs around protection were ensuring that basic services like shelter and water were addressed. But we then got some contradictory feedback later, suggesting that the protection assessments had not taken sufficient account of gender and GBV issues. And so from a donor perspective, I think we ultimately are going to be very demand-driven and field-driven. If we aren't getting a demand signal from the field for a certain type of programming, it's hard for us to second-guess that. So I think it's very important at field level to ensure that the assessments are done well, and that we take a sufficiently broad view of protection to be sure that we are capturing the views of all the different groups, and not taking a sort of broad brush approach that may miss some really important factors.
Thanks, Jeremy. Clearly, the protection and the centrality of protection and bringing it to the HET is an issue that has to be taken really globally. And your message is basically every country, every operation, everybody who's listening has to put the centrality of protection at the center, not just of the protection cluster, but really also the senior leadership in order to bring it to fruition. So that's a clear message really for all colleagues listening. And also your example of the Philippines, really protection is not just on a conflict situation, but also on a natural disaster, and how to really take it on board in the best possible way. I'd like to move to Sofia and ask actually a question we got from a caller. It is also a provocative question, and the caller is saying, really, the gender marker at the project level doesn't work for us in the field. So would it be better to use the gender market at the strategic response level? Sofia, what do you think?
Thank you for that question. I will answer it, but just this, because I think that one, given what Jeremy said about the centrality of protection, of course the protection of women and girls and the gender issue has to be part of that. And I totally agree with what you said, Panos, that the centrality of protection has to be not only an issue for the protection cluster, but for all colleagues. And the gender issue is definitely a very good illustration of that. Sweden, we have since a few years actually a requirement in all our humanitarian funding that we do not fund any projects that do not have a gender marker. So to get the feedback from the field that this is not working is obviously really important, and I would like to hear more about that. I think one has to work at both levels. Obviously, at the SRP level, the gender issue has to be a clear integral part of that strategic planning and prioritization process, and if that is a form of a specific marker or how you do it, but definitely to keep the gender issue as an integral part of the SRP process throughout needs assessment into planning and also follow-up and assessment is really key. Whether at the project level a specific gender marker should be there or not, I would say that also at the project level, the gender analysis has to form an integral part of the setup of the project. But really, if the colleague can share some more feedback on why exactly it doesn't work, I would be grateful, because this is a key issue for us to follow up on. Thank you.
Thanks, Sofia. I think that the message here really is on the importance to always include women and girls' needs in the planning. Obviously, this is not a specialist issue. This is really a cross-cutting issue that needs to be mainstreamed across all sectors, across all clusters, really to be in the center of the response. And again, I think, like we were talking before, whether it's a natural disaster or a conflict, this is a priority message you're giving actually for all donors. This is really a common question we hear again and again, and to make sure that from an operational point of view, there is content. I think whether it's it has to happen on a bottom-up way, at the cluster, at the meaty part of the program itself. And of course, it would be reflected in the strategic response plan. I'd like to move to another question we've received from a caller. And Klaus, I'd like to direct this question to you. You were talking earlier on about the accountability to affected people. And the feedback from a caller from the field, he says, really, the accountability, it is still not taken up at the humanitarian country team. It is still doesn't come up from a collective point of view at the system. How do we fix it? What is your donor view? What would you like to see happening to bring the accountability to life in a much more vivid way at the operations? Klaus, over to you.
Well, thank you very much, because accountability to affected people is actually right in the center of our concerns, because why the hell are we here? This is about actually making sure that the aid reaches the people that actually need it, and it has to be the help and the assistance that makes sense for them. So we have simplified quite a lot our contracting. We are operating with key performance indicators, etc., and some of them in a very generic form actually do mention accountability. Have you actually had interviews with your beneficiaries? If you had that, okay, then do you get feedback from them after you have delivered your assistance? So there is a willingness and there is an insistence from the side of us as a donor to make sure that we close the loop and verify that aid has actually been well received, and also that it meets the real need of the people and not just in a theoretical way. But you're right, it sort of slips between our fingers sometimes, and I have an idea which is actually to educate my auditors that are running around in third countries checking very much the financial tracking, to see if I can educate them in actually doing some accountability checking as well. Have we actually delivered what the people in need were asking for? It would take probably a year or two to put such a system in place, but I think we have to have a backup system that can support the actors in the field. Then, of course, apparently, this is not really discussed sufficiently in humanitarian country teams. What is the explanation? Well, I think people are busy. They have practical concerns. And the only thing I can say is that we will, from a donor side, increasingly look at that and make sure that we get good documentation. There is another issue of accountability that I think I should mention, and that is accountability vis-à-vis the taxpayers. So a lot of partners are screaming for simplification, and I just want to make the very simple point that if I cannot explain where the money goes, then one day there will not be any money. So it's a trade-off between simplification and actual accountability vis-à-vis those that have to cough up the funds. So it's about accountability in the field, but it's also accountability back to our citizens. Thank you.
Thanks, Klaus. I think the question of how to bring practically the accountability to affected people in operations is one that many struggle, and I think that actually the INGOs have a lot of excellent practice on this in some UN agencies. So your message is really on making sure it happens, and a lot of the knowledge is there to bring it to the center of the response to take it forward. Manuel, I'd like to move to another question we got. Actually, we have 7 humanitarian coordinators who are following us live to this discussion, and one of them, and actually 4 callers, have sent exactly the same question. And the question is really about resilience, about preparedness, about early warning. And the question is, why is this not funded? Really, we can save a lot more money if we react early enough to be able to do something about it than wait until things get so much worse and then it costs us 10, 100 times more. Why is there limited appetite from donors about resilience, preparedness, early warning? Manuel, over to you.
Thanks. Look, a question that obviously keeps us awake at night. There is this terrible saying, it's easier to find money for the coffin than to find money for the medicine. It didn't happen yet, the disaster. So how do you find the money to prevent it? I fully agree, it's really a bad saying, but it's a reality. Also donors, we have to justify the money we spend, because as Klaus said, it's taxpayers' money. I have to go at least once or sometimes twice a week to the Foreign Relations Committee and to explain them how we spend the money of the Swiss population. And of course the question is, yeah, but there are now starving people in country X, Y, Z. You have to allocate the money there. Long story short, we have not found yet the real key how to address preparedness, prevention. Some projects are to include it in costs of existing projects, meaning having a percentage of the cost of a project already sort of included for the next disaster, because after the disaster is before the disaster. A percentage will then be used for whatever comes next. One approach. The other approach is really advocacy, to talk, of course, also with the authorities of disaster-prone countries, because we know their monsoon comes as the Ramadan or as Christmas every year, and we know more or less which areas are flooded. So why don't you fortify this dam and make sure that we do not have the flooding again? But there you need, again, to be out there, you need the relationship, the trust of the counterparts, often governmental counterparts. There you have to work not only short-term, much more mid-long-term. So it needs a real engagement with the field. And given the short-lived, often on an emergency schedule operating humanitarian aid, this is quite a challenge to also have this more mid-long-term approach. Back to you.
Manuel, thanks. Actually, this question keeps on coming different ways from other colleagues. So I would also like to place the same question, Jeremy, over to you from an OFDA perspective. How do you really see this? I mean, clearly we all agree, as Manuel was saying, that the early response is much better than waiting until things get completely out of hand. Jeremy, over to you.
Thanks, Panos. I agree with what Manuel said, and I think that we need to, both as humanitarians, really articulate a case for this and be able to put some data on that, to be able to show how these mitigation measures actually reduce the risk and put some good evidence around that. We also need to push our development colleagues to engage more heavily in this, because the reality of the world we're in today is that there is an increasing level of humanitarian need. There is an increasing gap in between the needs and the available resources on the humanitarian side. And as Manuel said, when you have to make a choice about a specific dollar, it's always going to be more compelling to put that towards an immediate need than towards some preventative function. And so we do need the development community to step up more. And I think there are some encouraging signs on that. We at the Good Humanitarian Donorship meeting in New York a few weeks ago, we were joined by a World Bank representative who said the World Bank now is really starting to recognize disaster risk as a development concern, that the vulnerability to disaster risk can undermine development gains, and they need to look at that as more of a development issue. Now that's a kind of new way of thinking for the World Bank, and that's very encouraging. We need to see more development actors taking that approach. At the same time, I think there is a degree to which we as humanitarians need to put some of our own investment in this. And OFDA, over the years, has invested small amounts of money, but sustained over 5 to 10 year periods in East Asia and in Latin America, particularly in building up national disaster management authorities, building up disaster response and mitigation. These are not huge amounts of money, but over time, if you can sustain them, it really relieves a lot of the pressure on humanitarian actors. And there are very few places now in Latin America or Southeast Asia where the international humanitarian community would need to ever do what we're having to do in a lot of Middle Eastern and African settings. Because there's much greater capacity there. And we've seen the number of declared disasters that OFDA responds to in Latin America and Southeast Asia go down considerably over the last 10 years because of some of those investments and the increasing engagement by those countries.
It's fantastic to hear actually the case studies you mentioned with the results, and actually a recognition how important this is to happen. And I guess the message from all colleagues in the field is, can this happen everywhere? On the same stream, I have a question that actually I'd like to take to Sofia. Again, more colleagues with more questions. They're saying in chronic, protracted humanitarian situations, the humanitarian actors are often perceived to be substituting for development actors and for the national authorities. We have collectively failed, one of our callers is saying, to bring the development funding across the table. The World Bank, why is it we don't see the World Bank a lot more on the table in a timely manner? Often by the time they come, it's too late. We really want to see them early enough. How can we really make sure that the humanitarian development divide is bridged from a funding point of view, from an operational point of view, from a results point of view for the people we're trying to help? Sofia, over to you.
Thank you, Panos. I very much agree with that analysis that we have all failed in bridging this divide, and that we as donors really have to do our part in pushing the development actors to be early on the ground and to work, as Jeremy said, much more in building resilience and make sure that those protracted crises that the humanitarian community is to deal with are prevented or sort of dealt with earlier on. One initiative that we as Sweden is now working on is to see, in the context of the Syria crisis, how we can create a separate budget line from our long-term development funding, focus on the challenges in Syria, very much linking into our humanitarian assistance programs, but very specifically look at the development actors with our long-term development cooperation money. How can we then sort of, in parallel with the humanitarian efforts, try to build some resilience and more of a long-term development in Syria? For example, we now have decided to fund the World Bank in Lebanon and Jordan, working with the host communities, being sort of very much the first line responders to the huge refugee influx from Syria into Lebanon and Syria, and how can we work with our development partners, such as the World Bank, to support those host communities. I think that is a good example on how we as donors can really sort of force the development actors to come in earlier and help out where the humanitarians are just sort of overwhelmed with challenges. Thank you.
Manuel, can I also take your view on this whole humanitarian development divide? It's a question that I can see also on the chat box. It's out there. Colleagues are really interested to hear. So your point of view. Manuel, over to you.
Thanks. Indeed, a question that, given the stressed resources, is something we have to address. Look, we have to do justice to both approaches, development and the relief approach. We work with different dynamics. Humanitarian is very short term. You have to be flexible. You have to react more or less from 1 hour to the next, because you have to address the needs that can occur from one second to the other. When you think about earthquake or flooding, tsunamis, whatever. Development, they work more in mid-long term, and it would be good to hear them, perhaps also for a future panel like this, to invite them. They work more on a mid-long term perspective. They have 5, sometimes 10, 15 years sometimes as a time horizon to see their projects really roll out and come to implement and be implemented. So they cannot just unplug and redirect the resources from one day to another. They do not have this flexibility. If you think about, I don't know, reconstructing infrastructure, there you have an investment that is often years in the making. And this less flexible approach, because another target of the development community sometimes clashes with the humanitarian approach, which has to be quickly here and quickly responding to needs. So we see this particularly in agencies like SDC, the Swiss Agency for Development Cooperation, where you have clearly development branch, which I'm heading, and I have a colleague in the same department, in the SDC, who is heading the development branch. We have animated discussions because, yes, the different dynamics these two approaches work on. So there is still a lot of work to be done to bridge this gap and to be from the get-go together in a crisis. I think this will be the approach to have, at least at the strategic level, both the humanitarian and development together to address a crisis. Back to you.
Thanks, Manuel. Actually, all of you, you spoke on the development and relief, Manuel, Sofia, but also Jeremy, have provoked, I would say, a reaction that I just got from the field. One of the callers was saying, well, that's good enough, but really what we need is, how about putting a specific, well-funded pilot, a bridge project between humanitarian development, take a couple of case studies, make a few successes, and seeing how to bring the World Bank, how to bring the development funding and the humanitarian on the table at the same time to move forward. So this is really, as you can see, a very live, interactive. I'm also see we're getting quite a few questions. I see, Klaus, you also want to respond to this one very briefly, because I'd like to move on to the next question right away. So Klaus, over to you.
Here it works. Thank you very much. Well, mind you, from our side in ECHO, we have actually had such a component in the shape of the Deep ECHO, where we have gone in, for example, in Turkana, teaching the pastoralists how to do culling when the drought was kicking in, so that they were able to regenerate their herd much later. We have, and this was great news for me in Nepal, we were running drilling training programs in the hospitals in Kathmandu, and I actually noted with great satisfaction that that was one of the components that worked. during the earthquake recently. Equally, we built up with very little money local capacity in Tacloban, just by chance. So there were disaster management teams in place that actually could be deployed. Had we not done it, it would have been there. But the real trick is to shift the mindset of our development colleagues. So the pilot projects have to be scaled up. And actually, the big sector programs have to target vulnerability and risk. So if you have a food security program, you have to push it out in the villages, and you have to make sure that it actually targets the most vulnerable. If you have, surprise, surprise, a transport policy in a country, you have to make sure that the investments you put in are disaster-proof, so that when the flood rains come, you actually have maintenance teams that can come in and make sure that they restore the transport corridors. The same goes for vaccine. You need to have a cold chain, not only in the big hospital near the president's palace, but out in the villages. You need some generators that can make sure that the vaccine actually stays there, so you have a resilience in case you have an epidemic. And I think actually our development guys, including the World Bank, that has become, I think, a different World Bank from the one I knew 20 years ago, they understand that if they don't deal with risks and vulnerability, they are going to lose big, big money. So there is a common interest in the humanitarians feeding into that system, because we know where the real vulnerabilities are. Thank you.
Thanks, Klaus. This is a topic that I can see we get a lot of questions. It's one of the topics that has been proposed for an entire webinar to look into this humanitarian development. I'd like to actually also take Sofia's point of view on this very briefly, and then I want to move to more questions. We have a few more minutes left, so I'm trying to take as many questions as possible from our colleagues listening. Sofia, over to you.
Thank you, Panos. Just on the point raised by can we develop pilots, etc., and that is precisely what we're trying to do now in Syria. But it is a challenge, and very much aligned with what Klaus said. I think to have a shared analysis of the situation and what needs to be done is quite a challenge. The humanitarian mindset and the development mindset are quite different, and it took quite some time to in the Lebanese context, for example, to get into this shared analysis. Although the challenges and the understanding of the situation was quite. I mean, there was quite a good common understanding on that. To then work on a joint plan on what to do was not the easiest. And one key issue for us in this context is that the development actors need to be much more risk adverse. They need to come in and share the risks with the humanitarian community in a way that I think is quite difficult. And there we as donors have our part to play in asking and tell the development actors that we are to prepare to share those risks. The school that is built in the DRC, Eastern DRC today, might be not there in 2 years' time, but possibly the World Bank should build it anyway. I mean, that types of discussions, I really do think that we need to have much more with all actors involved in those protected crises. Thank you.
Thanks, Sofia. I'd like to move into actually another area of work. And Jeremy, I think this is a question for you. A caller from Mogadishu is sending us a question saying, in humanitarian programming, in contexts like Somalia with limited access, where we use remote monitoring and management, how do we ensure that there is, as a collective, we remain accountable in this context? How do you view this remote management and these extraordinary situations where we cannot be where we should be, yet we do everything we can to help the people in need? Jeremy, over to you.
Thank you, Panos, and thank you for that question from Mogadishu. I think that is a hugely important issue as we look at the humanitarian scenery for the next 10 years. You know, some of the biggest crises that we now have to deal with are crises where access is very constrained. So Syria obviously is the top example of that. But we've seen it also in Somalia. We've seen it in northern Mali a few years ago. We see it in a lot of different settings, and I would point to two things that I think are encouraging and show some progress on this front. First is in Somalia and in Syria particularly, we've seen a lot of deepening of relationships and partnerships between international humanitarian actors and local humanitarian organizations on the ground. And that has been driven in large part by security and by necessity, that it's not possible to send in international staff to a lot of these locations. But frankly, that's also just a very good model for providing effective humanitarian assistance. The more, going back to the sphere standards, the first version of the sphere standards 20-some years ago, we have been saying for decades now that we need to put more power in the hands of local actors and local partners. And in places like Syria and Somalia, we're doing that through these partnerships. I think going forward, amongst the international NGOs, the NGOs that are able to develop these sorts of partnerships, not just as kind of subcontracting or funding pass-through arrangements, but as real substantive strategic partnerships, those are going to be the organizations that are really leading the way into the next few decades of humanitarian work. And that enables a degree of access even in insecure environments, but it also leads to better programming in a lot of settings. The second thing that I would point to is the ability to use technology in ways we haven't used it before. And so we're seeing in Syria and Somalia an ability to use mobile phone technology in project monitoring to enable verification that, for example, certain things deliveries have reached the intended site, that they've been handed over on a specific date to a particular actor, in being able to verify that through some use of technology in a way that wouldn't have been possible 10 or maybe even 5 years ago. And so I think there are some interesting technology approaches that we can also use to stand in place of more direct firsthand monitoring and management in secure environments. But I think also donors are more willing to accept a level of risk on this than we were a few years ago. We've gotten much more sophisticated in our understanding of some of these monitoring techniques. But also when you look at a situation like northern Syria, you can't just say, well, if we can't do firsthand monitoring, we won't provide help. It's just that's not tenable. So we have to accept a level of risk as well.
Thanks, Jeremy. This is encouraging, really, because it's all about adapting to reality and being able to do everything possible, including using modern technologies in an evolving and changing world. Klaus, I'd like to move on to you, and we just got a caller who sent a message, a listener who says, really, we have so many of these level 3 disasters, and this message actually comes from DRC Congo. So the colleague is saying all these 3-level disasters are really eclipsing, in particular, the protracted emergencies, some of the crises that have been on for some time, and also is affecting the needs of the most vulnerable in these places, because clearly it results to reduced funding. For example, for DRC Congo, in between 2010 and now, the funding has gone down, the needs are still the same. So what type of donor advocacy would reverse this trend of diminishing funding in protracted crises in view of so many L3s and competing crises all over the world? Klaus, over to you.
Well, first of all, I remember visiting North Kivu with a lot of other donors 12, 18 months ago, and it's clear that the main problem we have in DRC is a government that is actually not taking care of their own people, and they don't care, really, for that. And I think we should not underestimate the anger and frustration of a lot of donors, of a lot of parliamentarians that actually have to grant the money when they see persistent failure of governments to just do the bare minimum to protect their own people, and instead they see governments behaving like predators, actually eating out of the resources of the local population. So there's a political issue here that shows that there are limits to how much funding you can raise year after year after year when the politics look nasty. Second point, on the L3s, I just want to clarify, in my mind, the L3s were never meant that they then should take precedent in funding over a number of other crises. For me, declaring an L3 is a trigger for very fast deployment of people and of funds, notably in the beginning of an onset crisis, or if a protracted crisis suddenly morphs into something much more dramatic. And then it should be called off. And I think we are collectively thinking about how we want to do that, because now the L3s have taken on a life of their own, and people say, oh, here we have an L3, so we have to put all our money over there, which of course is idiotic. So we have to come back to the drawing board on that one. This being said, the decreased funding in DRC also illustrates a simple fact that there are limits to how much funding we have. So if you have a crisis like Syria, just zooming up to the top level and eating up all the resources all over the place, then something has to give. Because even if we have increased funding, we are running after the caseload. So there are choices to be made, and these are very dramatic and complicated choices. I think we can do a lot of advocacy to raise the attention on different crises. I mean, yesterday we had an event right up here in our mission with a lot of the good donors attracting funds for South Sudan. The other day we had for the Central African Republic up in Brussels. I mean, we are really trying to put the message out there, but the reality is that there will not be enough funding to go around. So the DRC may come back. We may find ways to attract attention, but they have always to compete with Syria or Iraq or Ebola and so on. It's tough. It's really tough.
Indeed, Klaus, this is the brutal reality of the resources are really not enough to cover all the needs, and that's where the prioritization, the quality comes into place. Yeah. But also, it's a system where, as many say, is the funding system broke? Is it really what needs to be done to be able to push, to advocate, to ensure that we meet the basics of the needs in terms of what we have? On the same topic, actually, Manuel, there is a caller who has sent a message, and he's saying, you're telling us to prioritize. We are doing our very best in the field to prioritize. Is prioritization at the field level rewarded by donors, or is it punished because we ask for less, we're going to get less? Manuel, over to you.
Hey, great questions, and really great to see all these questions coming in, to have this interactive exchange with the field, so you feel a bit part of the field. Look, we need this prioritization. As mentioned by Klaus, by others, there's just not enough money around to cover the needs. Today or this year it's 18, 19 billion. The new ERC announced 22 billion for the rest of the year or the years to come. The donors run always behind these needs, and they increase with a speed that is very difficult to match. So we need the prioritization, and yes, this requires tough decisions. And there is no way around. And to help with these tough decisions, we need the field, because the field knows best how the priorities look like out there. So we very much want to encourage the field to do prioritization, and we want to reward the field. But of course, for this we need a responsive field. We need a field that is led by the HC, by the humanitarian coordinator, that comes together in the humanitarian community, that speaks to each other and does not compete with each other, and then defines these priorities together, and not one agency more and the other than the other. So it's easy said, this prioritization, but it's actually a process that needs leadership at the country level, that needs HTC, a humanitarian country team that sits together, that trusts each other, that talks to each other, and then, of course, the donor community that has also to do its job to look at these prioritization or these priorities and reward prioritized action plan coming from the field. So very much, yes, please do more, please set clear priorities. This will for sure help us to allocate the unfortunately limited resources we have. Panos, back to you.
Thanks, Manuel. We have about 5 minutes or less left. There's a very specific question, Sofia, to you. If I can have a very brief answer. The question is about the 3RP model of humanitarian resilience-based response that was put together in the Syria crisis. What's your take on that? How do you evaluate it? Sofia, over to you.
Thank you, Panos. Quick answer, yes, we think the 3RP model in the Syria refugee crisis is a very good model. And it has a lot of value. In particular, what's been mentioning, how do we bridge the humanitarian resilience-based response? Having said that, I do think, and this is also where we're working on this, we should have much more development actors coming in on this type of plans, so that the humanitarian actors can possibly focus more on the immense humanitarian challenges inside Syria, and linking up to what Jeremy said about this sort of how do we get a coherent response. But definitely it's a good tool, but the development actors should also move in on it. Thank you.
Right. I'd like to thank Sofia. I'd like to flag to our colleagues that there is an assessment polling that's already on your screen. I want to encourage you all to go in and answer to the questions as we go through the last round. It's really vital to hear your views, your feedback, how useful you found this webinar, but also what webinars would you like to hear more. I'm actually going to give 1 minute to each of the panelists, and I'd like to ask you all if you could give your final message from a practical to the field to help them really with the resource mobilization, with the prioritization, with the efficiency. If you have 1 minute or less each, what is your key message that you would like to give over to them? Jeremy, please go ahead.
Thanks, Panos, and thanks again to everyone for joining this. It's been a really interesting conversation. You know, my key message would be we need to be a system. Not a patchwork. We need to work together. You know, each of us have different roles in this, but we need to be coherent partners. And when we see infighting, when we see turf fighting, when we see you know, the UN and the NGOs not getting along, when we see you know, those kinds of problems, it makes the whole system much less effective, and frankly, it also makes us less likely to put resources towards that kind of a situation. So where we see coherence, the resources will follow.
Okay, Jeremy, it looks like you're very well informed, and clearly a strong message on unity and all of us being together. Manuel, I'd like to come over to you. What's your key message?
You know, Churchill once said, I have no time to be short. To summarize the key messages in 1 minute, it's really a tough call. But I would say, look, stay with the humanitarian principles. Have this neutral, independent approach to meet human suffering and look at the needs. And for this, you have to talk to those who are in need. So be close to the beneficiaries and design your project with the beneficiaries. Thanks, back to you.
Closeness to the beneficiary is really a vital one, which we all know how transformational it can be, what a huge difference it makes to the quality in terms of what we try to do. Klaus, I'd like to ask your reflections. Over to you.
Well, this is hopeless because Jeremy stole my first line and Manuel stole my second line. So I actually wanted to say work together. When we smell trouble in the field, infighting, when one agency doesn't want to fold into the strategic plan, when methodologies are different, then the donors get edgy. I get edgy. And also, as Manuel said, just to reinforce, I think we all have, when we are out there in the field, and I'm not very often in the field, but I do come there, think about what would you feel if you were in their shoes. It's about what we do for them. So if you always keep that perspective, I think actually it would send a strong message on what should be done and how do we manage our system. Thank you.
Thanks, Klaus. Sofia, over to you. What are your reflections and message to the field?
Just to show how extremely well coordinated we are as a donor team, my message would be that you have to work as a team with your colleagues from the other agencies, NGOs, beneficiaries, come up with a coherent strategic response plan with very clear priorities, and we can almost promise you that the money will be there. Thank you.
Thank you. Thank you very much. I'd like to, first of all, thank our 4 panelists, Sofia Calltorp from the Ministry of Foreign Affairs in Sweden, Klaus Sorensen with the European Commission Humanitarian Office, European Union, Jeremy Konyndyk with the USAID, OFDA, and Manuel Bassler with the Swiss Agency for Development and Cooperation. Really, it's been a fantastic panel, fantastic to have the principals, the decision makers on with us, and to have really so many of the colleagues listening. Of course, a warm welcome also to over 120 colleagues who started with us an hour and a half ago and remain with us to the very end of this conversation. We do hope you found it useful, you found it practical. I really want to repeat, please take a minute to look at the polling, the assessment of this webinar, to give us your feedback, your brutal, your honest, your direct feedback in terms of how you found it. I would like to, we'll keep you informed on future webinars. We will continue trying to do about once a month webinar on the transformative agenda and issues that are close to your heart that can help advance the understanding and the efficiency, effectiveness of the operations at the field level. So from all of us here in Geneva, I just want to say a big thank you and wish you all the very best. Goodbye. This brings an end to this webinar.